There are some states that are different. There are some states that don't have much of a problem. There are some, well, they don't have the problem. They don't have thousands of people that are positive.
Antibody testing right now is not the first thing on our priority. It's something that we need to do, is testing to see if someone is infected.
We will be there for you as long as you need us to be there for you, and we will share everything we can.
We need more testing, and we need results quicker.
It is very important, ultimately, to be able to get a feel for what the penetrance of the infection was in society for a number of reasons.
But I have absolute hope that we will emerge from this stronger and better than we've ever been.
This is important for patients. It's important for all of us that we get the results back quick.
You know, things will get better. Infectious diseases like these, they will come, and we will fight it, and we will eventually have a vaccine, and it will become a history story again.
Remember the sights and sounds of 2020? Restricted restaurants, shuttered schools, dedicated distancing?
It seems like a lifetime ago, living 6 feet apart, but the reality is it's been just 5 years. Welcome into this WTOL 11 special presentation, Echoes of the Pandemic. I'm Kaylee Maritat.
And I'm Jeff Smith. Looking back, we are taking a tale, and we're talking about a tale of two worlds. St. Patrick's Day 2020, bars were closed, the world was socially distanced, and we were living through mask hysteria. We're taking a look back at the global pandemic, how it reshaped our lives and how far we've come.
We start in March of 2020. From lockdowns to vaccines, it's a time we'll never forget. Sophia Pericone takes us back to how it all started.
It's hard to imagine a time before we knew about the pandemic. And looking back 5 years later, it's hard to imagine an industry that went untouched by it.
It was devastating news for us.
And it was so unprecedented.
WTOL 11 first reported on COVID-19 in January 2020. Then Toledo Lucas County Health Commissioner Eric Skaczynski said hospitals were bracing for impact.
Anytime that something like this happens, you want to get ahead of the curve.
But Ohio wouldn't feel any real shifts until March. On the 5th, the state banned fans from the Arnold Classic. Just 4 days later, the first confirmed case in the state, and on March 14th, a case in Lucas County.
Just because you want to get tested, there are not enough of tests. We have to make that clear.
From there, cases climbed across the state. March 20th, marking a new grim milestone, Ohio's first COVID death.
There are going to be a number of inconveniences. Inconveniences is too mild a word in many ways.
And just 2 days later, a statewide stay-at-home order went into place, closing schools, restaurants, retailers, and more.
My fellow Ohioans, we have not faced an enemy like we are facing today in 102 years.
My heart sunk, and I'm like, oh my goodness, how are we going to survive?
Schmucker's in West Toledo wasted no time. Owner Doug Schmucker says the next day, his dining room was completely shut down, pivoting immediately to curbside pickup.
That was pretty painful. The learning curve was not very happy.
And while nearly all restaurants shifted to what became the new normal of 2020, some jumped into action.
We made hand sanitizer.
Using the high-proof alcohol they already had in-house, Mommy Bay Brewing Company tapped into their supply, producing a once highly coveted necessity in 2020, hand sanitizer. Then giving it out for free.
The amount of security that something so simple that we just had the resources to be able to do and give back to the community was very humbling.
The weeks that followed continued to be a challenge for hospitals dealing with surging capacity, for businesses facing unprecedented restrictions, and individuals adjusting to a new way of life.
There wasn't access
to the gym. And so what that created was either you were being creative with what you had, or some people just stopped working out.
Fitness 419 gym owner Luis Lozada says he saw a lot of people lose touch with one another, falling off their typical routines.
What that caused was the loss of that outlet and that community and camaraderie that the gym brings.
But after months of closures, some relief in late spring. At the end of April, Governor DeWine started unveiling staggered reopening plans, starting with healthcare offices. More businesses were given the go-ahead by the end of the month. All of this contingent on social distancing, masking, limited capacity, and curfews.
We moved tables out so that they could be separated as needed. We got plexiglass devices made so at the counter you could sit next to somebody.
In July, a new mandate, one requiring masks in the city of Toledo. The state followed suit on the 23rd. Both the state and local mandates would last until June 2021, but before that, a glimpse of hope. In December 2020, the first COVID-19 vaccines were administered in Ohio.
3, 2, 1. Vaccinate!
But life didn't return to normal right away. In 2021, businesses still faced some challenges.
It forced us to look outside the box that, status quo isn't going to work.
And even now, 5 years later, effects of COVID-19 are still sprinkled into everyday life.
We have distanced our tables still a little bit more than what we have in the past.
Wiping things down more regularly.
But also now, a new appreciation for the people that pushed us through the pandemic.
Without the support of our staff, it wouldn't have happened.
In Toledo, Sophia Periconi, WTOL 11.
When COVID hit the U.S., it was something unknown, something new. There was caution, but not fear, at least not at first. But since then, claimed the lives of more than 44,000 Ohioans. One of, if not the first to lose his life was Mark Wagner Sr. from Ottawa Hills. Another Toledoan lost 4 family members, including the heart of his family. And as Melissa Andrews reports, those losses hit differently due to some significant restrictions.
The COVID pandemic was cruel. It shut down businesses, closed schools, and socially distanced us. But some of our friends and neighbors were also robbed, their loved ones taken, new memories gone, and facing death alone.
And people were scared. There was just a lot of uncertainty.
Mick Wagner was one of the first faces of the pandemic. He died on March 18, 2020, just days after shutdowns began and bars and restaurants closed.
And our reaction was, how does Mick Wagner from Toledo, Ohio have the virus from China?
His dad was 75 and had heart disease. He had traveled. Days later, he fell and went to the hospital. Respiratory issues developed.
The day before he was intubated. Yeah, I shared it with him. I shared with, he didn't know he had it. He knew he had been exposed to it.
Mick died days later, thankfully not alone.
We were with him when he passed away, so they allowed us to go in and be with him.
This was a baptism.
The Martinez family in South Toledo wasn't as fortunate.
They were able to FaceTime us to say our last goodbyes. And we literally watched it on the iPad. Say goodbye.
Adam's mother, Frances, died at 72 on August 11, 2020.
My mom was really the heart of our family. So she took care of a lot of my grandmother, my great-grandmother, helped raise all of my cousins. She was really a phenomenal person.
Frances lived with her son's family. They took all the precautions since Frances had diabetes, a pre-existing condition.
We did everything and then some. So we wiped everything down with, bleach wipes. We were wearing masks outside, gloves outside. We wiped down anything that came into the house. If we went outside, we were separated.
Adam's family suffered greater losses. COVID also took his aunt, her daughter, his cousin, and an uncle.
It was very devastating months back to back.
On top of that, so little was known about coronavirus. Skepticism grew online about the deadly virus Adam had witnessed firsthand.
At the time, I was kind of on Facebook and just seeing some of the stuff that I was really surprised by people I respected, in terms of basically saying my rights have nothing to do with your family getting sick.
So really, I mean, you lost family members to COVID, and then you lost some friends and acquaintances because of their reaction to COVID.
Yeah, absolutely. And I still have family members that didn't think the virus was real.
Those same questions prompted the Wagner family to protect others by publicly speaking about Mick's death.
It's not a good thing to have your name associated with, you know, the #1 communicable disease in the country or in the world. So it was a challenging time, but you know, it brought us closer together as a family. And I think, you know, my takeaway on it was just about everyone I talked to was trying to do the right thing. And, you know, you can always disagree what the right thing is.
Both men told me they appreciate all of the doctors and nurses who risked their own lives and worked with compassion and care during such an uncertain time. Melissa Andrews, WTOL 11.
While families struggled with loss, healthcare providers rushed to rethink the business of care. And though those mask mandates have been lifted, local hospitals learned a lot during the pandemic. Amanda Fay shows us what changed then and what's still happening now.
Late March 2020, entering a hospital suddenly looked much different than it ever had. Screeners greeted patients at the door, taking temperatures, asking health history questions. Hand sanitizer and later masks became something not just hospital staff would use, but everyone inside the building.
I think that everyone can probably say that their lives have been changed through COVID.
In what seemed like the blink of an eye, healthcare systems, including Mercy Health and ProMedica, were forced to adapt as those early cases started coming in. Vice President of Medical Affairs for ProMedica's Metro Hospitals, Dr. Brian Kaminsky.
We even had separate areas for our waiting rooms for people who were presenting with COVID or non-COVID-like symptoms. We had installed a variety of different ways to provide negative pressure ventilation in our emergency departments and in our rooms.
At Mercy Health, Chief Clinical Officer for Toledo, Dr. James Tita, says his biggest memory of that time was the need for isolation.
We weren't even sure exactly how contagious it was, but given the fact that we didn't have any effective treatment, given the fact that it seemed to have a high mortality rate, we had to go to great lengths to make sure that we protected the staff, we protected each other, and of course protected the patients.
The need for protection came with some major challenges for health systems. Doctors Tita and Kaminsky say the fight for PPE, personal protective equipment, was on.
I mean, we were rationing masks, we were rationing gowns, we were trying to get as much equipment as we could.
Dr. Tita said that led to anxiety for healthcare workers, which became another challenge for hospital systems. It's one that is still being felt 5 years later, and Dr. Tita says it means hospitals may be less ready than needed if another pandemic were to strike.
Obviously, there was a big turnover of bedside workers, so nurses, respiratory therapists. I mean, it took a terrible toll on them. In terms of replenishing those ranks and recruitment for all healthcare systems, that continues to be a challenge.
Healthcare workers say they saw many seasons of the pandemic, beginning with support from the community. Then there became anger, resentment, mistrust.
So suddenly, you know, those heroes that we celebrated taking care of COVID initially turned into villains.
Doctors Tita and Kaminsky say we lost 1.2 million Americans during the pandemic, many of them in isolation. And those psychological, emotional, and spiritual scars remain.
At some point, I mean, we will have to deal with this, and I'm sure we are dealing with it, maybe not in the best way, but, you know, this this was a history-changing, a life-changing event for all of us.
Dr. Kaminsky says a lesson learned is dealing with the supply chain shortages. He says ProMedica dusted off its COVID playbook when IV fluids became low in supply following Hurricane Helene's impact on Puerto Rico and North Carolina. Another way hospitals adapted during the pandemic was through telemedicine, which ProMedica and Mercy Health still utilize today. For WTOL 11, I'm Amanda Fay.
Well, there's no question we all felt the effects of the global pandemic, but no age group may have felt it more than senior citizens.
More than 90% of all COVID-19 deaths were people 65 and older. Lead investigator Brian Duggar shows us there were also other severe consequences for this age group.
On March 11, 2020, Justin Moore is in California with his wife for a wedding when the world began to dramatically change.
And we were at a bowling alley and we were bowling and just everything completely normal, you know, and on the TVs was an NBA game.
At the direction of the National Basketball Association, tonight's game has been postponed.
And they just canceled the game in the middle of the game. And for me, I was like, whoa, this is real. This is not just some little thing.
A day later, it became even more real for the current president and CEO of the Northwest Ohio Area Office on Aging.
And we're trying to do absolutely everything we can to keep COVID out of the nursing home.
Governor Mike DeWine shut down visitation to the state nursing homes as COVID began to sweep through facilities.
And you have individuals who are, yes, they're in their own rooms, but you have care staff, home health aides and the like, that are going from room to room to room. And despite the best precautions with hand washing, hand sanitizing, wearing masks and the like, that definitely increases the chances of exposure when you have one individual going from room to dispense medications, to give food, so on and so forth.
By April, there were more than 100 cases a day being reported in Lucas County nursing homes. By the middle of May, 132 local nursing home residents had died from the virus. But Moore was also seeing catastrophic consequences for seniors outside long-term facilities.
There's a recent study that showed that social isolation or loneliness has a negative impact on somebody's longevity and health, equivalent to smoking 15 cigarettes a day. So during COVID, there's a lot of older adults that were getting that socialization, had regular touch points with friends, family members and the like, and then all of a sudden, boom, that just stopped.
There were no more senior center gatherings, grocery shopping trips, card games. Moore and his team had to be creative in working with a senior population that was hiding from the virus.
A lot of it was peer-to-peer, where older adults were volunteering and calling other older adults, just checking on them, get them some friendly visit telephonically. Sometimes people would do that through glass or through doors.
And sometimes it had to be done through tears. A former board chairman and current chair both lost spouses during the pandemic.
At the end of the day, we are all human beings that, while we have professional responsibilities that we take seriously, we are also individuals that have personal relationships that get formed with individuals. And COVID was a tough time because oftentimes there is tremendous loss of individuals that are very close to us, that passing away.
Today, the biggest challenge for Moore and his team is to help heal the emotional scars for some seniors who are afraid to re-engage in society.
We start with giving them some socialization with a phone call, encouraging them to come participate in maybe one workshop that's happening at a senior center, or get them plugged into going to their local gym if that's where they want to go. But whatever it is, really trying to help be that individual, is reminding them of those things that they used to enjoy doing that they have not been doing, and encouraging them to take a baby step toward doing that again.
Ask any parent who had a kid in school. They'll tell you a story about learning during the pandemic. From remote instruction to virtual graduations, COVID forced teachers and students out of the classroom, and the aftermath is still being felt today. Kaylee Kirby shows us how district leaders did the best with what they had.
It was a foreign concept to have hundreds of school staff and thousands of kids in Northwest Ohio move their traditional in-person learning model to something that was entirely online. Before 2020, that frankly had never been done before, and not in the amount of time that they had to pivot.
March 2020. The spread of COVID-19 had already started to have its impact on the Buckeye State. Each day, many wondered what would come next.
I think we forget sometimes that it was scary. People were dying. We didn't know what was making it spread, or we didn't understand it at all. There was no vaccine.
But March 12th, 2020 is the day that changed the lives for millions of Ohioans. They just didn't know it yet.
So we are announcing today that children of the state will have an extended spring break.
Ohio became the first in the nation to issue a statewide school closure.
We thought we were going to be out of work or close schools and government entities for maybe 4 or 5 days. And then the next thing we knew, we were shut down for 6 weeks. Then it was 9 weeks.
It didn't last long before things started to turn. Cases were climbing, and so was the death toll.
To go back to school now with a relatively small amount of time left by a large number of superintendents, principals, others who've expressed to me that that probably is not a good idea.
The governor closed school for the rest of the academic year. In a matter of days, districts had to pivot out of a classroom and onto a laptop.
We were not a one-to-one district at that time. I think about our tech director, who took us from having about 4,000 devices in the district to 10,000.
They had to figure out how to feed their kids.
I would not have been aware of the number of kids that eat lunch with us and don't eat again until they come back to us.
Being the superintendent of a school district and navigating a pandemic was unprecedented.
There were a lot of sleepless nights. There were a lot of days where there was no appetite. When you hear that children are ill, when you hear that you've lost an employee due to COVID, you feel a sense of helplessness.
It's a job that became harder with a senior class losing the final weeks of high school and their impending graduation.
We did a 12-hour graduation. So we stood on a stage. I remember I didn't think my feet would ever recover for 12 hours and brought kids. We lined them up in a snake kind of pattern throughout the building.
Some districts even chose to do drive-through graduations. School leaders took a first time for everything approach.
Because it never had been asked, right? You don't know what you can do until the expectation is set. And not only did they meet the expectation, they went above and beyond and exceeded expectations.
As the weeks and semesters passed, districts navigated hybrid learning, social distancing, and eventually a full return back to class. There were challenges at every turn.
There was learning loss. And in some instances, we are still working to close that gap for children who were starting in kindergarten and first grade and maybe had some challenges in learning how to read, learning how to do math.
What would you say now, 5 years since it started, are some good things that have come out of this for a school district?
I think we're all much more connected, right? Our kids, we have a pretty good balance here, I think, of how much our kids are online. So now it's a tool. It's not the only tool.
COVID-19 has changed the entire landscape of traditional schooling.
I don't know if we would have changed so quickly or evolved so quickly if it wasn't something as serious as the nature of a pandemic. On the other hand, though, I'm glad it's so far behind us.
Both superintendents say a big part of getting through the pandemic was having all of the area superintendents and health leaders constantly communicating and making decisions together. Reporting tonight, I'm Kaylee Kirby for WTOL 11.
Well, of course, through it all, people needed answers. There were the daily briefings, lovingly dubbed Wine with DeWine, and the vaccine mandate and the latest mask requirements or business regulations. So local media like WTOL 11 provided updates constantly. Our team delivered critical information on air and online, even in multiple languages. Tim Miller takes a look back on how journalists kept you informed in this time of crisis.
Ohio just announced 600 new COVID-19 cases. Now, I understand that can be pretty alarming for a lot of people.
We are facing a shortage of tests for a number of reasons.
I feel like I'm living in an apocalypse right now.
3 perspectives from 3 people who had to balance the outbreak of COVID-19 with the role the media would play. Lori King is the editor-in-chief at the Toledo Free Press, but in 2020, she was a photojournalist for the Toledo Blade.
Life unfolded on my Instagram feed.
Lori took some of the most stunning and important photos of the time. This kid not enjoying a COVID test, capturing a COVID test being done on a body inside the Lucas County morgue, and a World War II veteran who could only see his daughter through a window at the Elizabeth Scott community in Maumee. Lori says her most iconic photo was March 11th, 2020, a fan cheering a Toledo Walleye goal with empty seats all around him.
Without the media, they would have known nothing. They wouldn't have known to wear a mask. They wouldn't have known about the COVID shots and where you can go to get them.
Lead investigator Brian Duggar looks at this week's numbers tonight.
WTOL 11 investigative reporter Brian Duggar reported every day on the COVID-19 numbers provided by the state of Ohio, a sobering task when so many were sick and dying.
It seems like this pandemic's never going to end, right?
He did many of those reports from here, Woodlands Park in Perrysburg, so he could stay socially distanced from his videographer.
We had decided as a station that we needed to give people information. We wanted to give them facts, not fear. It really was important because there are so many people that reached out to me, particularly senior citizens. They really depended on the numbers.
A confirming test for coronavirus will not change the treatment you receive.
That was former Toledo Lucas County Health Commissioner Eric Skajinski giving one of his many updates on COVID to the public. He became the face of Northwest Ohio's response to COVID, and he thinks public health's close relationship with the media saved lives.
The media is there to be your friend. They're there to be used to get information out. Without them, you're not going to be able to conquer a crisis. You're not going to be able to, direct people to what they need to do.
But the former health commissioner has a warning. We are still in a crisis. It might not be COVID-19, but he thinks another virus could come along and wonders if people will be willing to mask up or isolate again.
Do we have enough of testing? Again, I can go on and on with this list, but I don't know if we're truly prepared for that next event.
I hope we've learned a lot from it because, I think we'd be really naive and to think that this couldn't happen again.
If it does, Lori King will have her camera ready again.
It is our civic duty as the media to get that kind of information out.
In Toledo, Tim Miller, WTOL 11.
We were trying to recreate how we did things as well. And as I listened to Eric Skajinski, the former health commissioner here in Lucas County, as he was talking about kind of getting the word out, that was something they had to adapt to. And even Toledo Mayor Wade Kapsakavage, I talked to him this week. We're going to have that for you here in just a second. But he talked about just the daily briefings, the daily phone calls, the getting out the word to everybody. So it's not, typically we're the ones, we're calling up being annoying and saying, hey, can you find out the latest on this? No, they realized daily briefings were important for the media to put that word out.
They had to be up front. What I think is really interesting about the experience here at WTOL versus my experience, I was a reporter in Lansing at the time when this happened, is that I never worked from home a single day. I was in Governor Whitmer's briefings every single day. I was the only reporter allowed in there because I was in the Capitol and we were right there. So I was covering everything COVID related, and I was really in the heart and center. So March 2020 and the start of COVID has a special place in my heart because I never would have imagined anything like that.
I started here in 2020, and there were employees who I did not meet for almost a year before we had people start to come back in-house. So that was a weird dynamic. Our producers were all remote. The conversations that we had daily as far as what we would incorporate in our shows, those all happened on Zoom. Zoom became our go-to.
I still struggle with Zoom, truthfully, but it was such a quick adaptation. It's something, I have a little time capsule of 2020, actually, the first press releases we got and all that, because I feel like my grandkids are never going to believe me.
It'd be interesting to take a time machine back to 2019 and ask people do you know what Zoom is? Do you know what Microsoft Teams is all about?
Put some stock in it.
Yeah, there's the ticket. Well, from there, when the pandemic hit, Toledo, like so many cities across the nation, faced unprecedented challenges. I had a chance, as I said, to sit down with Mayor Wade Kapsakavich here in the Glass City to look at the early days of 2020 through his eyes. For Toledo Mayor Wade Kapsakavich, the reality of the pandemic hit home early in March 2020 when Ohio Governor Mike DeWine's tone changed during a statewide conference call.
We were on one of those calls, and the governor just adopted an attitude and a seriousness that I was not prepared for. He said, look, however bad any of you think this is going to be, it's going to be 10 times worse. And he started talking about MASH units outside hospitals. He was talking in terms of the imagery of body bags.
And for Kapsakavich, what started as distant news quickly turned into a local crisis. He hadn't realized the full magnitude of the virus, but the governor's warning jolted him and city leaders into action.
That day, we started activating our system up here, our emergency system, our partnership with the county commissioners, our safety teams, our health teams.
The mayor's response came as Toledo faced a sobering reality. COVID-19 was more than just a health crisis, it was an economic one as well. Kapsakavich points out that Toledo is a city heavily reliant on income tax, and that structure made it uniquely vulnerable. A national report from the Brookings Institute even ranked Toledo as one of the cities likely to be hit hardest by the pandemic.
Now that scared me. You know, it wasn't a decision I made, but I was frightened by how this could impact Toledo for reasons that were maybe spiraling out of our control.
While hindsight is always 20/20, Mayor Kapsakavich says he has no regrets about the steps taken to protect Toledoans.
We were making the very best decisions we could based on the information we had, being guided by science. And I think we would all make those same decisions now.
During the height of the pandemic, daily coordination with state and local leaders was critical. Mayor Kapsakavich remembers regular calls with Governor DeWine, Dr. Amy Acton, and other mayors across Ohio.
Here's what we're hearing about the disease and how it works and, mutates, et cetera. Here's what we're thinking about doing. But then the governor was very good about asking us, we're thinking about doing this. How would your city react to that?
As Toledo navigated the pandemic, Kapsakavich also had to deal with the social and emotional toll it took on the city's residents.
Sometimes terrible events have a way of uniting us. And there was a sense in those early days of unity, of neighbors looking out for neighbors, of people, good Samaritans, everything like that.
Through it all, the uncertainty, the stress, the weight of each decision, Kapsakavich says one thing remained constant for him, and it was his faith. A Roman Catholic who during his schooling met Father Tim O'Brien. And Kapsakavich says it was Father O'Brien's words and wisdom that changed his life, better preparing him for the challenges of the pandemic.
So you bet my faith was an important part of me making those decisions, and especially through the lens of a dad, because I'm a dad.
So while the pandemic strained Toledo economically and socially, Mayor Kapsakavich says his greatest source of pride comes from how the community, both leaders and residents, worked together to get through the worst of it.
I was proud of how we all worked together truly in a apolitical, bipartisan spirit. The governor is a Republican. The 6 big city mayors that he convened a phone call with every day are Democrats, and yet politics never came up in those phone calls. And it really was just a spirit of how do we get through this moment.
Jeff, the mayor talked about getting through this together as a community. Did he have any other positive takeaways from the pandemic?
One of them he wanted to touch on with me was crime. And he wanted to speak specifically that the further we get away from the pandemic, how he said crime has gone down, pointing out that there were 71 homicides in 2021 and saying right now, in the middle of March, there have been 3.
And when it comes to leadership, you may remember updates from the Ohio governors in Ohio and Michigan, along with doctors, experts, and even recipes from Fran DeWine. But one face stands out from the Buckeye State's 2020. Dr. Amy Acton. She used to be the state's health director. Now she's running for governor. I had the chance to sit down with her after 5 years from the pandemic hitting Ohio.
It's sort of like a hurricane that's moving toward us.
From day one,
we know these will be our hot spots.
As weeks seem to blend together,
life seems like it's shutting down.
Dr. Amy Acton was a daily figure in the uncertainty of the COVID-19 pandemic.
Dr. Acton.
Yes, thank you, Governor. Good afternoon, everyone. Happy Monday.
For months, she and Governor Mike DeWine were the voices, leading Ohioans through the start of a dark era.
We actually started building a response in January, and we did a massive tabletop exercise with all of government in very early February.
With the first global health pandemic in more than 100 years, where do you even start?
George W. Bush made the first pandemic playbook. He made it right after 9/11, when they recognized that a pandemic or a biologic weapon were the gravest security risks to this country.
Dr. Acton says many of the state orders that were put into effect were from that playbook.
Everything was collapsing anyways. Schools were closing anyways because you couldn't have cafeteria workers, you couldn't have bus drivers. All of these things that we were facing were going to happen, but they might have happened just in chaos. So the orders were a way to help us all row together.
Those orders restricted gatherings, closed businesses, schools, and pretty much the whole state. Moves, Dr. Acton says, were the only option.
In the beginning of COVID, the mortality rate in March of 2020, if you went in the ICU, you had an over 50% chance in large parts of our country of dying. By June, that mortality rate had fallen to 5. So, you don't want to throw that throttle. You don't have to pull that lever, but you do it when you absolutely have to save lives.
But that lever would spark rage. Protesters gathered not just at the State House, but outside Dr. Acton's house. It would be June 2020. Dr. Acton stepped down, leaving her position following those protests. However, she says that is not the reason she made the choice.
I actually stepped down because special interest in the State House, the Speaker of the House particularly, was wanting orders that weren't science-based, could actually hurt people. And one of the hardest decisions I've made, one I would always make again, is I told the governor, I'll keep advising you, but I can't sign my name to these orders because I knew they would hurt people, potentially kill people.
While she faced criticism for her orders, there were some who saw her as a hero.
Hi, my name is Amy Acton.
After her departure from Columbus, Dr. Acton says she was still involved behind the scenes, helping lead 11.7 million people.
There's nothing more motivating than not wanting your people to suffer or die. And it's a privilege to be in that position. It gives you an energy, obviously, that keeps you going, and I would do it 1,000,000 times over.
Now, Jeff, Dr. Acton is looking to make big decisions for the state again. She is running for governor in 2026 as a Democrat. We did reach out to Governor Mike DeWine for comment on how he felt the handling of the pandemic went, but his office declined.
The echoes of the pandemic still lingering. They stand as reminders of a time that changed all of us, from empty highways to quiet celebrations, uncertainty to resilience, and we've all come a long way.
We've learned, we've adapted, and we've grown. While we may never forget those early days of March 2020, we move forward with the lessons they left behind.
Thank you for joining us for this special look back for all of us at WTOL 11. Stay safe and stay strong.